February is Black History Month and American Heart Health Month, and we are spotlighting a local doctor tackling a deadly health gap right here in D.C. Heart disease hits Black communities in Washington harder than almost anywhere else in the country, and the numbers are alarming. Joining us this morning is Dr. Urooj Fatima, a cardiologist at Howard University Hospital who is leading efforts to close that gap, hoping to save lives and shape the next generation of doctors. Dr. Fatima, good morning to you. Thanks for being with us.
Thank you for inviting me here today.
Yeah, I want to start with, the last day of Heart Health Month, but important to talk about this all year round. Walk us through some of these statistics and why heart disease has hit Washington so hard.
It might be a last day for Heart Month, but commitment to heart health is year-long. I feel that DC natives and our community should be aware that preventative care is far more than treatment. Making small, subtle changes to your lifestyle, that could be adhering to a heart-healthy diet, regular exercise as you go along with your day, and then regular follow-up with your doctor are some of the things that we can do to improve heart health in the district.
Yeah, and when we talk about some of the disparities here in the district, what do you believe is the reason for that disparity?
So Washington, D.C. has a very high incidence of cardiovascular disease, and some of that is because of the social determinants of health. Lack of access to safe exercise places, lack of preventative therapies available, lack of follow-up. At times, the patients that we see in cardiac clinic might have underlying diseases such as diabetes, hypertension, and high cholesterol, untreated for years. So I think the biggest reason for such high prevalence of cardiovascular disease in Washington, D.C. rests in the fact that early prevention therapy, if they are brought closer to the patients in terms of them making them aware of their symptoms so that they can identify that and have appropriate follow-up with the doctors, we can definitely close that gap.
And we know talking about it, awareness is so important. What are some of the symptoms of heart disease that people should not ignore?
So there are some common symptoms of cardiac disease that most of the patients and their families are aware of. For instance, chest pain. But there are some other uncommon symptoms that we routinely see patients coming in with. Patients would come in with jaw pain, back pain, swelling of the legs, or fast heart rate. All of these could be symptoms of underlying heart disease, and they are worth getting investigated by a doctor. So in younger folks, and especially women, sometimes these symptoms can be very subtle, and they could be just fatigue, or not feeling well, or not being able to perform their activities of daily living because of shortness of breath with exertion. So any of these symptoms, if they are, it should prompt you to get a further medical investigation to ensure that you don't have underlying heart disease.
And we only have about 30 seconds left, but I want to ask you, what is Howard University Hospital doing to combat heart disease in underserved communities like Washington, D.C.?
So Howard University Hospital plays a central role in combating health disparities, and we have regular screening fairs, we have preventative clinics, we have community outreach talks and initiatives where our doctors, physicians, and trainees would go out in community and create awareness about heart disease. Not only that, we also have preventative clinics on campus and also as mobile units when we go to the community once every month or twice a month in districts in different areas of DC where there is highest prevalence of cardiovascular disease to create awareness. And I think that is integral in helping to close the gap that is there between prevalence of cardiovascular disease in our community.
All right, important work you all are doing. Dr. Fatima, thank you so much for your time this morning. We appreciate it.
Thank you.